This is the psychological and physical responses to injury. So the stage 1 is the hematosis. So damage to the small blood vessels and capillaries can occur frequently. There are 3 basic mechanisms that stop the bleeding or promote the hematosis. Following damage, the vessel constrict to prevent the blood loss. Exposed collagen from the wound attracts the platelets, and then including the final mechanism is the collagen. This is where the fibres attach to the pellets to form a mesh which hardens, so for example a scab. This could be, for example, like in the photo of Wayne Rooney with his cut eye. This could be getting elbowed in the eye, playing football when you go out for a header. So stage 2 is the inflammation. So the stage is essential for the tissue to repair. So this occurs 1 to 3 days. So for example, sprain after the injuries first occur. So that can last a few weeks, like an ACL. It's the protective stage. A chemical called histamine released that causes the pain, and then the swelling and the constriction and the vasodilation. So the vasodilation allows the blood to enter the area to help protect the wound. Healing will not occur if there's an inflammatory stage. Then the stage 3 is the proliferation, so it's the tissue formation stage of healing. So the stage 1 is develop the new capillaries around the injury site to encourage healing, known as angiogenesis. Stage 2, so the cells called fibroblasts start to lay down, and this is a supportive network to stabilize the injury. This is known as a fibrolytic repair. The type 3 is a type 3 collagen form. It's great scar tissue, however it is built within little support due to the fibre tissues being placed in random orders, making it weaker than normal tissue. And the last stage lasts from about 24 hours to 6 months. And then the stage 4 is the remodeling. So now the scar tissue is refined, the fibres have been supported and repaired, making the tissue a lot more stronger. The type 3 collagen is replaced with type 1 collagen. This can take from 7 days to 6 months. So an ACL tear would usually be the end of it, so like a 6-month period. So factors affecting the healing process, it could be at the age, because young athletes have better skin elastically, it means they have reduced chance of scarring. This is because they still hold elastic tissue and the collagen fibres in the outer dermal layer. Then their sleep, so the recovery speed can depend on the quality and quantity of speed you're getting. Also nutrition is key because proteins help repair the torn muscle fibres, which speeds recovery. The treatments such as cryotherapy will definitely speed up recovery. The athlete's psychological state can alter the recovery time. The psychological responses to injury. Injuries sustained in sports result in physical and psychological harm. The athlete's mental and physical health must be taken care of while he or she recovers from an injury. Sergio Canos, an athlete who plays for Brentford, is one of the examples of someone who has experienced this. He tore his ACL, which kept him out of football for a long period of time. While he's recovering physically, he started to become depressed, and once he fully recovered, he decided to kick-start his footballing career again by leaving his team Brentford to start fresh. And the stages of grief. So Elizabeth Kubler-Ross in 1969 had a look at the stages of grief. She goes into the detail of 5 stages in grief, although people not to always go through these stages one by one. So some skip the steps and some relapse backwards. However, it is a normal thing to do. So the denial and the isolation. This protects us when the emotions are shock. We resist the withdrawal from anyone. So as they're in denial and scared to come to the facts. So athletes are scared to go to the physio. So for example, when athletes are injured, they know they've done something wrong, but they go into denial and just don't want to hear the news that they can't play. And when that the denial wears off, the anger starts to kick in, and this is a common way to become angry. So Neil Maupay injuring Leno in a football match shows his anger off while being in the stretcher, because Neil Maupay was the reason why Leno was injured. So the bargaining is the reality of the sport kicking in. Feel helpless and overthinking of how it could be different. For example, thinking to yourself, if you didn't go into that one challenge that one time. And the depression, the reality of practical implications, which are sadness and worry. For example, having no control of the period of time you're out. So seeing your friends in a football team, your teammates playing, and you'll just feel helpless. Acceptance, this is the final stage of the ultimate acceptance. This could be having the realization of the withdrawals. For example, this is a new hobby and fresh start, as you have a realization you're not going to be back at your best ever again. So the question was, analyse how this model would differ for an athlete who has a ligament sprain compared to one who has a career-ending spinal. So a spinal injury, you wouldn't have denial, as you cannot deny this serious injury like a spine. You could end up having depression as you weren't able to play sport, and it's a thing you love. Injuries are common, which means athletes should understand their career can be taken away from them at any moment. So, in 1998, Weege, Borstel, Smith, Shaffer and Maury developed this model. It describes 3 independent responses which athletes make following injury. Targeting all 3 responses can help maintain the motivation and self-belief. This is a cognitive appraisal. So this is getting that goal adjustment with the rate of recovery perceived, and then the self-perceptions of it all, so the belief and attributions. So there's also a sense of loss and relief, so the cognitive coping. And the emotional response is fear, tension and anger. And then the depression, frustration and grief gets in the emotional response, having a positive attitude and emotional coping. And the behavioural response will be a goal adjustment, rate of perceived recovery, self-perceptions, belief and attributions, and a sense of loss and relief. The difference in similarities is that they both have stages, and one stops about the dealing with repression, and one has 5 stages to prevent depression, and one only has 3 stages. Thank you for your time.